Hi everyone, my name is Nur Zafira binti Kamaruzaman and my matrix number is 205594.
Hi everyone, my name is Noshiratul and my metric number is 206175.
Hi, my name is Farisha Rashida binti Rudi. My metric number is 206332.
So in today's video, we are going to discuss about what is Gaucher disease, the symptoms, causes, diagnosis, and the types of Gaucher, and also the treatments that involve to cure this disease. So, according to the National Organization for Rare Disorder or NORD, Gaucher disease is an inherited metabolic disorder because of the accretion of glycolipid glucocerebrosidase in our body, usually in certain organs, for example, bone marrow, spleen, and liver. And this accumulation of glycolipid glucocerebrosidase will causes this organ to enlarge in size, and this may affect their function. And based on the research that have been made by the National Library of Medicine, 1 out of 50,000 to 100,000 people in our population are suffered from Gaucher disease, and the most common type is the type 1 disorder. There are many symptoms for Gaucher disease. The first one is enlarged organ. This is due to the accumulation of the glycolipid glucocerebrosidase in this organ like liver and spleen, which will result in the inability to function well. So the next one is anemia, where anemia is a condition in which you are lack of healthy erythrocyte or red blood cell to supply an adequate oxygen throughout the body. So third, people who suffered from this disease would probably have insufficient amount of platelets in their bloods, which mean that they might easily getting bruised, bleed, and have blood clotting problems. So because of those symptoms, the people who have been diagnosed to have this disease may feel very tired or fatigued in their daily life. Next, they also may experience some skeletal problems where they might feel pains in their bones or having osteonecrosis, and maybe they will have fragile bones which can be broken easily. Other than that, the patient will have eye movement disorder and brain disorder. Because of the brain disorder, they might experience some seizures and jerky movement. Last but not least, they also might have lungs problems, which mean that they will be difficult to breathe like normal people. So in Gaucher disease, some people might experience a very mild symptoms, and some people might show the symptoms starting in their childhood, meaning that the symptoms might be varied depending to each person.
Next, we move to the cause of Gaucher disease. Gaucher disease is caused by an inherited deficiency of the activity of beta-glucosidase, which is lysosomal glucocerebrosidase, a membrane that is associated with monomeric glycoprotein. This enzyme usually hydrolyzes beta-glucosidase ester bond, and it is specialized for complex lipid substrate. As we know, impairment of its activity will result in the accumulation of glucosylceramide linked by beta-glucosidic bond. Glucosylceramide is at the end of the glycosphingolipid catabolic pathway, and it is normally catabolized into ceramide and glucose by glucocerebrosidase. Next, as you can see in this figure, it is a glycosphingolipid catabolic pathway. the impaired activity of the lysosomal glucocerebrosidase will result in the accumulation in macrophages of glucosylceramide, which is normally catabolized into ceramide and glucose. Next, we move to the causes by the molecular biology and also the genetic. More than 300 discrete mutant alleles have been identified in the beta-glucocerebrosidase gene. Mutation include both insertional and also point mutation, as well as crossover mutation with the pseudogene. The most common mutation is mutation adenine to guanine point mutation at nucleotide number 126, which will result in the substitution of serine for asparagine that will decrease the catalytic activity of the enzyme and also a mild phenotype. Other common mutations include insertion of guanine at nucleotide number 84, which will induce a shift in a reading frame with no enzyme production and a severe phenotype. The next mutation is a mutation timing to cytosine mutation at nucleotide number 1448, which proline is substituted for leucine, which will causes a severe loss of activity and a severe phenotype where homozygous patients have a neuronopathic form. The last mutation is a mutation guanine to adenine mutation at nucleotide number 1604, which will result in the substitution of histidine for arginine and will produce a mild phenotype. So how Gaucher disease is diagnosed? Gaucher disease diagnosed using a blood test that will check your enzyme level. But to determine if you are a carrier of Gaucher disease, healthcare will do a DNA test using your saliva or your blood, because Gaucher disease carrier doesn't have any symptom, but they can pass the disease to their children.
Now I will present about the types of Gaucher disease. Gaucher disease can be categorized into two types, which are the non-neuronopathic and neuronopathic. Non-neuronopathic means that it does not involve the brain or the spinal cord, while neuronopathic means that it involves the central nervous system. So for type 1 Gaucher disease, it falls under the category of non-neuronopathic, and it is reported to be the most common one in the Western countries. Type 1 Gaucher disease can begin in the childhood or adulthood, where it will affect the bone or multiple organs. Patients can also suffer a variety of symptoms, but it depends on the severity of the disease. For example, like an enlargement of the spleen or liver, which caused by the accumulation of Gaucher cell with too much glucocerebroside, or low blood count due to the buildup of Gaucher cell in the bone marrow and spleen, so the body cannot produce blood cells. Next is the type 2 Gaucher disease, that is also known as an acute infantile neuronopathic, and it is a severe form of Gaucher disease. It can be deadly within 2 years of birth. Symptoms of type 2 Gaucher disease can be detected as early as 6 months after birth. The symptoms for type 2 Gaucher disease are skin abnormalities, seizures, and swelling of spleen and liver. Unlike type 1, type 2 Gaucher disease involve central nervous system problems, so it is not treatable. Next is the type 3 Gaucher disease, that is also known as a chronic neuronopathic Gaucher disease. It is more common than type 1 in countries like India, Middle East, China, and Pacific Rim. Type 3 Gaucher disease is similar to type 2, but it progresses slower compared to the type 2 Gaucher disease. People with this type 3 Gaucher disease can survive adulthood, but they will also suffer a variety of symptoms, for example, like seizures and bone deformities. One can also suffer from dementia, but in an advanced stage of this disease. So now we move on to the treatment for Gaucher disease. There are two types of treatment, which are the enzyme replacement therapy and substrate reduction therapy. So for type 1 and type 3 Gaucher disease, enzyme replacement therapy is being used as treatment, and it works for both adult and kids. But this treatment does not work for type 3 Gaucher disease that has developed into brain or central nervous system problem. Enzyme replacement therapy works by substituting the defective enzyme beta-glucocerebrosidase with a modified version of this enzyme. This enzyme will help to break down glucocerebroside that has accumulated in the patient's body. This treatment is usually given to patients through intravenous infusions. This treatment is effective for non-neuronopathic disease as the enzyme cannot cross the blood-brain barrier. So that is why it is used for type 1 Gaucher disease and also type 3 Gaucher disease that has not developed into brain or central nervous system problem. This treatment has many advantages, such as it has fewer side effects and it has wider availability. This treatment was approved by FDA in 1991. So now we move on to the substrate reduction therapy. This treatment works by stopping the body from producing glucocerebroside. It uses small molecules which inhibit synthesis of the cell membrane component that break down the beta-glucocerebrosidase. So when the substrate enzyme decreases, the waste product will also decreases. This treatment, however, is only available for certain type of patient. It is not suitable for pregnant or breastfeeding women, children or teenagers, and also adults that age more than 65 years old. This treatment also has side effects which include diarrhea, fatigue, and also nausea.